everybody. I'm Tammie.
And I'm Pam.
And here at Chota, we are collectively known as Tammie. We are the care coordinators for Chota. And disclaimer, we're not wearing our masks today because we've both been fully vaccinated. And according to the CDC, small gatherings with fully vaccinated people, you don't have to wear your mask. So yay for that. We're here today to talk about colorectal cancer screening. And I'll let Pam dive into the facts.
All right. So we'll use the terms colorectal cancer screening and colon cancer screening kind of back and forth. It's basically the same thing. So just the primary goal of colon cancer screening, we want to say first and foremost, is to save lives. Colon cancer is one of the only cancers that a routine screening can actually prevent cancer. So when you come here to Chota and our provider nurses are consistently asking you, hey, have you had your colon cancer screening? Are you interested in it? That is why we are committed to saving lives and making sure that our people in our community are as healthy as possible. So who should be screened, Tammie?
Who should be screened? Normal screening is anyone, man, woman, of the age of 50 to 75. And there are numerous types of colon cancer screens that can be done. If you are at high risk, say you have a brother, sister, child, mother, father who has had colon cancer, you should have them more frequently and start at an earlier age. So speak to your provider about your timing. But typically on just preventative screenings, we start at age 50. So the three types that we talk most about, number one is the colonoscopy, the dreaded colonoscopy. Everyone hates to talk about that. But typically the worst part is just the prep. The colonoscopy is a breeze. You're put under, you sleep through it. So that part's great. And at that point they visualize to see if there's any polyps. Polyps are what eventually do turn into colon cancer. So they'll go in to your colonoscopy, remove them, never have to worry about them again. So, Pam, want to take over the next one?
Yeah. So like she was saying, most colon cancer develops from precancerous polyps, and the colonoscopy, they go in, they remove those. Again, you don't have to worry about it. Typically you're good for 10 years, and then we start asking you again at year 10. Regular screening for and removal of those polyps reduces the risk of developing colon cancer. That's bottom line. The thing about the colonoscopy is that if there is a polyp found, or God forbid there's cancerous cells found, or even a tumor, it can be treated at an earlier stage. And early detection of cancer in the colon that's already present increases the chance of successful treatment. So if you go in there, you get your colonoscopy, they do find something, they're able to get you on a treatment plan, maybe go ahead and even remove it. And you don't have to worry about things that grow and things of that nature. So bottom line, early detection means better treatment options and better outcomes.
The other two types are IFOBT or FOBT cards. We here at Chota have the IFOBT. It's a one-time test. It's to be completed yearly, and what that's looking for is hidden blood in the stool. So that, as long as it's negative, you just do that yearly. And then we also offer to order Cologuard for patients, and that's the DNA test. It's a lot more specific. It looks for a lot more than just hidden blood, and those, as long as you're negative, are good for 3 years. So those are good options too. If you don't want to have a colonoscopy, those are pretty easy options.
And those are options that you do at home as well.
Absolutely.
So risk factors, what puts you at risk for colon cancer? Age. As we age, we are more likely to have those polyps that grow in our colon. And so, as Tammie said, men and women ages 50 to 75 need routine screening for colon cancer. There's also genetic syndromes that require genetic testing that puts you at high risk as well. A personal or family history of colon cancer puts you at high risk, and inflammatory bowel disease like Crohn's disease and ulcerative colitis can also put you at high risk for colon cancer.
Things that could help reduce those risks. Some lifestyle modifications, stopping smoking, getting more exercise, losing some weight. A diet high in fiber is important. That helps with the reducing the risk of colon cancer. Also helps with cholesterol lowering. Exercising more, of course, alcohol, decreasing the alcohol intake. Those are all important things you can do to help decrease your risks.
So what is the best test? We get asked that quite a bit. How do you know what is the best test for you? Well, the best test for you is what you and your medical provider choose after discussion and medical history review. There is not a one-size-fits-all for everybody. That's why we offer so many options for screening. It's whatever is best for you, and that will be determined after a conversation with your medical provider.
So give us a call. We'll be happy to help you. Get scheduled whatever you need to schedule.
And places where you can get more information, good, reliable information. Sometimes you can get information on Facebook that's not always the most reliable, but the most reliable places are online, www.cancer.gov, www.cancercoalition.org, the www.cdc.gov, and you can search for colon cancer screening. The CDC has a huge section of their website dedicated to colon cancer screening, and if you've received an IFOBT here and we've reached out to you to get that returned via mail, one of the flyers that we send out is actually from the CDC website. And of course, always, we encourage you to discuss with your medical provider any questions that you have, what kind of screening is good for you, and we will also add these links to these websites with the video.
I think that's about it, but poop can save your life, so remember that. And you'll probably be hearing from us later from behind the scenes at Chota.